the community, staff and parents or others that might be joining. This evening's town hall is being recorded, so just keep that in mind so that if we are reading things perhaps out loud as far as comments or questions that you want us to answer, we might be repeating them so that folks watching later can hear. And so we have a few people here this evening to talk about the Binax Now testing that the district has engaged in. And I just want to introduce folks that you're seeing on your screen and essentially their relevancy, to being here this evening. So the first thing I'll do is introduce two folks that have volunteered an awful lot that have helped us throughout the entire pandemic with everything from health protocols to thinking to testing. So first of all, we have Shreya Shah, Dr. Shah on the town hall this evening. Shreya is an oncologist at Kaiser South San Francisco, and she has two children in DLI at McKinley in 1st and 3rd grade. And the other community parent volunteer we have is Vivek Jain. And Vivek, of course, is also a parent. He's a parent of children at Franklin Elementary and an infectious disease physician at UCSF, as well as the head of infection control for San Francisco General, where he's directing clinical care. So thank you both for continuing to volunteer and help us. And they are here to answer a lot of your medical or technical questions about the testing. They've helped us to stand up the testing. We also have, of course, district personnel here and their functions. So we have Dr. Joelle Spencer that's here this evening, as well as Assistant Superintendent Silversmith. They are responsible for student testing in the district. And Kirsten Diktakis, my assistant and the board, I'll call you the board coordinator. How's that? The board coordinator who is responsible for adult staff testing. And I, of course, am Chris Mount, the superintendent. And so by means of introduction, I just want to explain the reason that we are doing both. The Binax is initially school districts in California, you might have seen the press conference by our governor, have been told that they will collect by Cal OSHA the vaccination status of all employees in the school district. We coordinated vaccination for our employees last year, so that's been a big help. And employees this year, as they're coming back or onboarded, are turning in their vaccination status. And if they are unvaccinated, then we have to provide an option for on-site testing for employees who are not vaccinated. And so that's one of the things that Binax satisfies, is it allows us a quick and relatively easy and painless opportunity to test our unvaccinated employees weekly, which we've already started doing, and it has been going just fine. And that's the part that Kirsten's in charge of. And then we have the other side, which is looking at the application of the Binax test. Vivek and Shreya, our volunteer guests this evening, said it would also be a really great idea, particularly given the contact tracing and the student requirements this year, that if we do have a positive test in a classroom, it's also a rapid way for us to do testing and to mitigate students, whether they're direct or indirect contacts, because we're masking all the time. It allows us to keep those students in school unless they test positive or become symptomatic. And so it reduces the amount of in and out time of students, which would, of course, disrupt the teacher and cause the teacher to have to go into short-term independent study and regular classroom and to figure out where their students are. So it really minimizes the potential disruption of a positive contact in the school environment. And so that's why we also stood up something that is more than a lot of other districts are doing, and that is that we are doing student testing using the same platform, the Binax, for potential exposures in the school district. The significant question that I keep getting is, why are you doing both the Ambry and the Binax? So the Ambry is more surveillance testing that we're offering through volunteers. That's actually something that Dr. Shah has been heading up with PTA volunteers. That is more surveillance testing so that all families have access to free testing for their children, in addition to the other options that we keep providing via my weekly messages. And that is a PCR test that is so that you can monitor your child on an every other week basis at this time. The Binax is if you give us permission during school, a school employee will be able to test your child if there is a positive student or exposure in their classroom for an indirect or direct contact, and allow us more flexibility with leaving the child in school. So that's sort of the overview and the introduction. And with that said, I know that folks might have questions, but if folks want to sort of start, any questions that they're getting that are frequently asked questions that maybe we can start with while folks warm up to the idea and might shoot out a question or two. So I'll start with Ms. Diktakis. I know you're doing the adult testing, which has been the majority of our testing at this point, both those that are unvaccinated as well as those that just sort of wanted to try Binax out for the first time that are vaccinated. So why don't you talk a little bit about how that's going and common questions you're getting, and maybe anybody can jump in and answer them.
Great. So thank you, Superintendent Mt Bonitas. We are conducting the weekly testing of unvaccinated staff, as he said, as well as vaccinated staff. There's been some that have tested. We have started last week and also this week. We have had a tremendous turnout, 100% of all unvaccinated staff to be tested, and we currently have 100% negative results. So that is great news. Questions that I receive from staff primarily are around if they're sick, what do they do? And if do they need to test each week if they're vaccinated? Just very simple questions like that. The staff have been really good and have understood it and done a great job of participating.
Great, and thank you, Ms. Diktakis. And that brings us to the first question we're getting from staff and parents. And if one of our volunteer doctors wants to answer it, that'd be great. If you're symptomatic, if you're not feeling well, what should be the response, whether it's for a child or a staff member?
I could take a stab at that first question, Chris. So first, just thanks for having us. Thanks so much. And thanks to everyone who's joining in, taking the time in the evening to join in. I just wanted to say hello to the district and especially to folks at Franklin, where my kids are. I think one of the big important things for this fall and the winter is, this is stuff that I think everybody knows already, but not coming to school if you have even a little bit of a symptom is a really important thing for this fall and winter. I know that before COVID, you know, there were some scenarios where a symptom could be mild enough that you could it was sort of okay to go to school. We're just in a bit of a different, moment, as we all know now. And one of the most difficult things about COVID is that in a lot of people, it causes no symptoms. In a lot of people, it causes very mild symptoms. And unfortunately, those symptoms are really similar in the scope and nature to lots of other non-COVID upper respiratory things. So we don't have a good way of knowing whether something's COVID or not. So probably the most important thing is to just, if you think someone's even the faintest bit symptomatic, to just go ahead and keep the child at home. I generally think it is a good idea to then do some COVID testing. And the Binax, we'll talk about it a lot during the session, is a quick, easy test that can be done. It's available off the shelf at some pharmacies and online. It's being used nationwide, kind of a do-it-yourself at home. There's also lots of other testing options available in our community in Burlingame and throughout San Mateo County that you can access that are not do-it-yourself. You'd go into a test center, but those would be the basics.
Great, thank you, Dr. Jane. And Dr. Shaw, would you be able to explain for all of our benefit what type of test the Binax is and why we can turn it around so quickly in 15 minutes and what kind of help that is for us to be able to do that type of test in a school environment?
Yeah, so the Binax testing is what we call rapid antigen test. And that's different than the PCR test, and that's what Ambry is. So the rapid antigen test, again, turnaround time is anywhere between 15 minutes to 30 minutes, but they're just looking at virus, sort of parts of the protein of the virus. versus a PCR test, you actually have to amplify, take it to a lab and amplify the virus. So it does take longer in terms of a turnaround.
And could you just briefly explain how, particularly for parents on the call this evening, how is that helpful to opt into letting the school test your child with Binax if there is a positive case in the classroom? What does that allow them to know that we weren't able to provide before?
Right. So if there's a positive case in the classroom, what we try to do is decide which of the students in the classroom are deemed to be close contacts. And so assuming that most of our younger students, all the younger students are unvaccinated and they are close contacts, with Binax testing, we can enact a modified quarantine. And what that means is we can allow those close contacts to remain in school by testing them with the Binax test. It's twice a week for 10 days, with each test being at least 3 days apart. And if these students remain asymptomatic and remain Binax negative that entire period of time, they can remain in the classroom. We do ask that they don't participate in extracurricular activities, but they can remain in the classroom, which is great.
Great. So just to sort of restate to make sure I get it right. So if we have a positive test in a classroom, last year we used to close classrooms down for 14 days. This year, with the new guidance, as long as everybody is masked in the classroom, if there's a positive test case, we only test the close contacts, which varies by classroom, and our school nurse will take care of determining who's a close contact. But if those close contacts don't have symptoms and don't test positive, they can stay in school during that 10-day period while they receive testing. Is that correct?
Correct.
Great. So very different from last year. That's great. Assistant Superintendent Silversmith and Dr. Spencer, how about student testing? How has that been going so far, and what are the big questions coming out of that?
One of the main questions I've been getting is who does the swabbing? Is it the staff member? Is it the student? It's actually, the individual that is being tested, which is pretty neat. And we can test a variety of ages. I don't know if our medical professionals want to hop in, but that's one of the major questions I've been getting from both staff and students and parents. So, it's a pretty simple test, and it only takes a few minutes to produce a result. So it's pretty great that we're able to get results so quickly and not have to mail them in to wait for a result. So.
Great. And you mentioned age. Could you clarify, or could anybody clarify? I know originally I saw it was available for students in grades K through 12, but that seems to exclude our TK students. Can anybody clarify that?
Yes, we reached out to California Department of Public Health, and they have let us know that students that are age 4 years, 9 months, which are our TK students, are all able to be tested now too. So we're excited that any student over the age of 4 years, 9 months is able to be tested with Binax through our district.
Great, thank you.
I'll say just to add that at a lot of the community testing sites that I've worked with here in San Francisco, the experience has been really good. I think people know from early on in COVID, the type of swab we were doing at the beginning was very different. That was a nasopharyngeal swab, which goes quite high and back into the nasopharyngeal cavity, uncomfortable. This is something we learned over time during 2020, is that you can actually just go lower and lower in the nose, and the performance is really quite good for the test. So this Binax now is really just swabbing the very lowest part of, if I could just say, the nostril, and really just putting a Q-tip in one nostril, 15 seconds, putting it in the other nostril, 15 seconds. We've found that in a lot of community testing sites, and this is true nationwide, that kids well down to 5 years old are able to do that Q-tipping. And if any child needed help, help could be provided. But it's gone quite well overall.
Great. And any anecdotal student testing reports that are sort of cloaked so that we don't give away any specific information, either Dr. Silversmith or Dr. Spencer, I'm sorry, ABD Silversmith or Dr. Spencer, that you'd like to share?
I would like to give a shout out to our community members who have had children that needed to be tested. They have been incredibly patient, and signing up for Binax is a very important thing for our community because it really does allow us to respond very quickly. And all of the parents that have opted into that, it's been extremely, extremely helpful. And it's great to see our community coming together and supporting one another. I know sometimes COVID can cause us a little bit of stress, but thus far it's been great. And I've just been really proud of our parents for supporting us.
Absolutely, Dr. Spencer. The one thing I would add is when you do go to primary health and you sign up, there's 2 verifications. One will go to your cell phone and one will go to your email. And before we can test a student, both of those have to be verified. I would say that's the one thing that we spend a little bit of time on, making sure that Chris Mt Bonitas's mom or dad has actually verified both of those. So that is one component that has been just taking a couple more minutes, but it's very easy to do. And most people are doing it actually directly from their cell phones.
And Chris, would you like me to say a word about a couple of other uses of Binax and where it can come in handy? I know we touched upon one scenario.
Sure. I do know, I would like you to do that, Dr. Jane. Kirsten, are questions going to be live? How are we setting them up this evening?
They are going to be live.
Okay.
Attendees can raise their hand if they have a question. So far, we have 2 right now.
Great. So attendees, give us 1 more minute of your attention, and then we will open it up to general questions. And if you don't have a lot of questions, we will play out a couple of scenarios of how Binax is being applied in schools. So Dr. Jane, why don't you go ahead with some other applications of Binax?
Sure. So another scenario that could happen, probably will happen a fair amount, is that a child could come to school feeling well, doing great in the morning, but then a symptom could develop during the school day. It wasn't there in the morning, and it's noon, it's 1 p.m., and then some type of symptom is happening. And this program will give the schools the ability to give a quick Binax test for that child at school in that moment, and it's an opportunity to get some quick information. So for example, if it's positive, it's good to know that as soon as possible. Then you can help start working with the contacts in the classroom. You can also give the family that information right away. That information is very valuable to that family. If it's negative, it's quite reassuring and helpful. And it can help speed up the return of that child after they are better from those symptoms. So that's one use. And then the other thing that a lot of school districts around the country have seen when they use Binax is that when there's one child who might be positive, or we get a positive test in a classroom, and then we have to go and have a look at the rest of the children in the classroom, sometimes one or more of those other children is actually having a mild symptom that might not have been apparent or realized before the situation became a situation. So it's also an opportunity to find other people who might be having a symptom. You can also test them quickly and just speed up the time to results, get information to families so that they can use it in the way they need to, and help the class as a community to kind of process through that one test result.
Thank you for that. Any other general comments before we open up for questions, or things that folks want to sort of highlight before we take any questions that community members might have? Great. So Ms. Tiktakis, I'll let you facilitate questions, and we will all chime in on items that we need to.
Perfect. Okay, first up will be Eric Brown. After that will be Gina Fleming. Eric, I'm going to unmute you now.
Hello, can you hear me?
We can hear you, Eric.
I just had a quick question. When you mentioned the routine testing for unvaccinated staff, is there a significant portion of unvaccinated staff, and is there any consideration for mandating vaccination?
Great question, Eric. No, the number of vaccinated staff, we're verifying new hires. Things have changed a little bit over the course of this summer. So prior to this summer, districts were not actually able, even though we were coordinating. So I actually helped coordinate the vaccination of staff because we were able to accelerate that so that staff could get vaccinated earlier. But previous to the new requirement by Cal OSHA, we were not asked to ask the staff to actually submit verification that they were vaccinated or not. That changed over the course of the summer. So now the employer can actually request that, which is what we've been doing for returning staff as well as for new staff. And so that gives us the number that are not vaccinated, and the number of non-vaccinated in the staff of non-vaccinated staff, and that includes, by the way, all of our contractors, is extremely low. So it's lower than, it looks like it's lower than 3%. But there are folks that for different reasons have chosen not to vaccinate, and frankly, those aren't for me to ask. I can just ask for verification or not. And then if they are not vaccinated, what the state has said at this time is that we need to do testing once a week, which is what we're doing. It has not gotten to the stage yet, and probably won't, I'm guessing, until the fall or the winter, that school boards are allowed to discuss the idea of mandating vaccination for anybody that would like to be an employee or associated with the district, like a measles or a TB shot, which is the type of thing that we require now. Those legal guidances for school districts and all employers are still developing. And remember, we're not private, so public, we have to sort of follow the guidance from the state. So they've sort of been increasing our ability to ask and to have routines go through, but at this point, it's not something we can require.
Okay, thank you.
Sure.
Okay, next up is Gina Fleming, and after that will be Joanne. Gina, I'm going to allow you to talk. You can go ahead and unmute.
All right. Hi, can you hear me?
Yes, ma'am.
All right, thanks. I have a toddler crawling on me, so I'll try to be brief. My main question is about the definition of close contacts. I'm not an epidemiologist, but from what I understand, COVID, especially with Delta, is primarily transmitted through aerosol spread. And so it shouldn't matter if, my child is within 6 feet of another child, or if she is across the room, if they're indoors. And even actually the San Mateo School District recently updated their definition of close contacts to be anybody in the class. I was just curious if I understood, if I understood that correctly about if there's a child in the class who's positive and, they're all indoors, if I'm right to assume that there is a huge risk of aerosol spread, even if there's not close contacts. And if this district has considered updating the definition of that, like San Mateo did.
So I think you're asking two questions. One is a policy question, which I can address, and the other one is more of a medical question, which I'll let one of the doctors touch, Gina. So the policy question is, what does the county currently consider a close contact, and the guidance that we're required to follow in school districts? So the current guidance is that anybody indoors, now everybody has to be masked indoors in public schools in San Mateo. We are masking indoors and outdoors out of a preponderance of caution, but anybody indoors within a 6-foot radius of the person who's tested positive for 15 or more minutes is considered a close contact. And that's what the contact tracing done by either the County Department of Health or by our nurses, that's what they'll determine. Now, If we look at a classroom where students are not stationary, meaning that they don't have an assigned seat and they're moving around indoors and they could be moving from group to group, Gina, then we actually do consider the entire class in that case to be a close contact. And we have only had one instance in the first 5 days of school of a positive result in a classroom, and it was a class that moves around from station to station. And so we considered the entire classroom a close contact. So the answer really is it depends. So if the students are stationary and have assigned seatings, which is more common the higher the grade level, then it's only students within a 6-foot radius for more than 15 minutes. If they're moving within the classroom throughout the entire day, then we consider it to be the entire classroom. So it's one of
That's
those
super
fun
helpful.
answers. Yeah, so sorry, it's a little complexity there, but we sort of do it both ways in our district. And now the other question I heard was more of a medical one, and I don't know, which was that basically because of aerosols, you were saying that you were concerned that really any contact is a close contact. And I don't know the answer to that with masking. I don't know that stuff well enough. So if one of the doctors would like to talk about that.
Yeah, I could say a word about that if it's helpful. Thanks, Gina, for that question. It's a good question. So the science around and physics really around the transmission of the viral particles has we've learned a lot, over the past year. And what it really kind of looks like is that, droplets are bigger and airborne particles are smaller. And what it really looks like is that people can produce particles of different sizes, really complex, and we don't fully understand why some people might produce more on the droplet end and other people might produce more on the respiratory end. A couple of things at the outset, though, are that everyone will be rigorously masked, and that really helps contain, particles of a pretty wide range of sizes. You're absolutely right that it's possible to put airborne particles, even though you're wearing a mask, although it is mitigated. And we have really excellent ventilation systems. I think everyone is familiar in Burlingame, the kind of HVAC system we have. We're lucky to have, I never knew this until COVID happened, but we're lucky to have this kind of HVAC system that allows you to dial in the fraction of outside versus inside air. And those are being set to, full bore outside air coming in. So we have actually like really excellent air changes going on in the rooms. A lot of experience was gained in the winter of 2020 into 21 with classroom settings at times when community transmission of COVID was really, really high. And the standard contact trace approach that Chris was talking about, where you just look at 6 feet, 15 minutes, seemed to pick up most of the risk and most of the kids. It did not look like places and cities and school districts were missing out on cases that were happening had they considered the whole classroom exposed. And in general, the experience in classrooms, we got a lot of great data from a bunch of different places around the country. And this is all, of course, before anyone had the chance to be vaccinated, which is another layer that's come in. So I think overall the feeling is that rubric of the distance and the time works pretty well. Things can change, and the data is, being monitored. I know the county is able to change, if data is indicating something different, changes can be made in that policy, but seems to be a very safe approach at the moment.
Thanks.
Thank you for your questions, Gina. Mrs. Diktakis, do you have another one lined up for us?
Yes, Joanne, I'm going to go ahead and unmute you.
Hi, I apologize if this was covered. I've joined a few minutes late. I actually had a couple questions. The first one is whether we would be, where the Burlingame would have a dashboard that is going to be updated. I know we did last year for the Ambry results, but also others.
Yeah, that's a great question, Joanne. So it's interesting. There were 3 districts in the county. I wouldn't say that we went rogue last year. We just went more on the side of transparency, and we disaggregated the information and we shared positive tests actually for our students as well as our adult population last year, and even during the height of the pandemic. So when we came back, transmissions were actually much worse than they are now, and we were able to do it safely. So we will continue to do that. So we did it all last year and we will be continuing this year. So we just got the results from Dr. Shaw of the first round of, the sort of mass student testing, the one with Ambry. And I think there were over 1,100 tests that were taken out. And so we'll be publishing the results on this week's communication and linking it. We will also be publishing the results from any adult and student Binax testing as well. So we're going to add that as a new layer. Now it's all disaggregated, so you can't necessarily tell which school or which person because that's their private information. So we'll be just publishing it as an entire district, but yes, we will continue that practice.
Superintendent Mt Bonitas, I'd just like to add that on our homepage, the burlingameschools.org homepage, there is a button that is red with a mask. It's our COVID page. And if you click on that on the right-hand side, you will actually see a link to dashboard. So that has been active and will be updated as the materials come in. Oh, thank you, Ms. Stiktakis, for showing us.
Stiktakis. There you go.
The button, the big blue button on the right-hand side above the state of California, if you click that, that is our current dashboard that will be updated this week.
Yep.
Great. And then my other question is, how integrated is the contact tracing relevant to Champions and the Burlingame Rec Center classes being held at the school? And if there is a positive case in either Champions or the Rec Center at the school, then does the same rules apply as the kids could be tested and still stay in the classroom, even though that it was happened at an extracurricular, but still be able to stay in the classroom if they had a negative test? And is Binax available to them if it happens in that scenario?
That is an excellent question. And I've had to learn a lot about this. So here's the answer. And you're going to go, what? That doesn't make sense. But here you go. So Parks and Rec, which operates as a recreational program in the county, and Champions, which is actually technically a daycare provider, even though we rent space to them on campus, they operate under different protocol than K through 12 systems. So and I found this out, Joanne, because we had exactly the situation you're asking about happen at the tail end of last year and then again in summer program. And I was trying to get an understanding of why the situation was with Champions, and they still had to quarantine for 14 days. And we were no longer doing that. We were in masking and modified quarantine. If you were asymptomatic, you didn't have to quarantine. And it's because they actually are controlled by, so Parks and Rec programs and daycare programs are controlled and regulated by a different body of the county. And so they actually follow different requirements, and it's attached to their licensing to provide those services. So the school district does have a great partnership with both organizations, and we really love both partners and what they give to our community, but they have to follow their own regulations, and we can't impinge on that. We can only follow what we can for the school day because they have different laws they have to follow.
Okay. But you wouldn't have details. We would need to contact the Parks and Rec and Champions for how they would handle it. But from what you're saying, if there is a positive case, then all of Champions or the close contacts in Champions or the Parks and Rec would have to quarantine for 14 days, which would exclude them from school for 14 days.
No,
Sorry,
their program is separate from the school. Mm-hmm. So hypothetically, and I don't know what their current guidelines are, to be honest with you, because they diverged and they're now different from ours. That's all I know. So the last time that we had this issue with Champions, for example, they were still under the positive close contact was a 14-day classroom closure, which means that the students were all on home quarantine for 14 days. The school district is if the child that's positive is on quarantine, certainly, but the close contacts, as long as they were masked and as long as they're asymptomatic, are on what they're calling a modified quarantine, which means they stay in school and we can test them twice a week in that 10-day period. And as long as they test negative, then they are permitted to stay in school.
Would that information be communicated directly by the family that we were at Parks and Rec, if somebody was tested positive, we were told we were close contact, we've tested that they're negative, or that we are deemed a close contact, then the school would pick up with the Binax testing?
So anybody that champions gets as a positive, if it's one of our students, they're required to notify us.
Okay, got
So
it.
that's how we would find out. That's actually the only avenue that we have of finding out. And then we do our contact tracing with them to determine any close contacts.
Thank you.
Sure. Sorry that gets complicated. It was complicated for us as well to understand.
Thank you, Joanne. Next up is Mike Dibbs. Mike, I'm going to go ahead and unmute you.
Yeah, hi everyone. Thanks so much for having this. I had two kind of air quality related questions, kind of following up on some of the HVAC comments. I guess the first is that I think there's been a lot of discussion about keeping the windows open in classrooms or not. I guess given your comments about HVAC, Vivek, do you think that is important? Well, windows and doors being open is important or required, or is the HVAC system kind of taking care of the airflow?
So I'm definitely not, nice to see you, Mike, by the way.
Yeah.
Very nice to see you. I'm definitely not too much of an expert in the, like laminar airflow and the mechanics and things, but I think it's a great idea to have the windows and doors open. It just increases air movement. And I think having those open actually makes the HVAC air intake and expulsion of air even more effective, because then there's just more kind of like passageways for the air to get pulled in from the outside and expelled out. So it makes the system, it increases the air changes per hour of a room. So I think as long as the air quality is acceptable, and I know this is just such a tough combination for us to have to be facing off against COVID issues and wildfire smoke issues and environmental things. And I feel so sorry that we are kind of in that position of that dual challenge. So there might be some special things that are needed on days when the air quality due to wildfire smoke is bad. Maybe I could let Chris comment on that.
Yeah, sure. So a couple of variables. Some of this depends upon the site that you're at. So for example, if you go to, and these are just some examples, most of our schools like McKinley and Lincoln and Franklin, they have the HVAC systems that Vivek is describing. And so they have air exchange, but yes, exterior doors and windows, we still very much want to keep open because it does exactly what you're describing. It increases the number of times per hour that the air completely changes over in the classroom, which then it creates a much healthier environment. So we want to continue that. There are some rooms that actually don't have that mechanical air exchange. There's specifically what we call the wing buildings at BIS. They were designed with giant fans that actually exchange and move air, and the Hoover rooms, and they don't have outside doors and windows that open as much as doors that open to interior corridors with giant fans and air exchanges in the hallways, which change over all of the air in the entire building. It's a much more modern system, but it's sort of counterintuitive. We have to keep the interior hallway doors open in that building. So folks are pretty clear about how their rooms work. Now, when we cross-reference that with air quality, once we get what the county calls beyond the orange tier in air quality, we start keeping students in more, particularly if they have issues that are going to interact with bad air quality. In that case, we would close outside doors and windows. We still leave the interior doors open, right, that go to interior hallways, and we keep our air exchangers on full because the filtration systems we have on our HVAC are good for particulate particles as well as the particles, the aerosol particles for COVID-19. So in those cases, we open the interior doors and keep our airflow going. Now, we do actually, if the smoke gets really bad, then it can cause us to keep kids inside all day. And of course, if it's really, really bad, the county says it's over 300 on their meter, then that's when they start recommending that schools consider closing. But we would let you know about that as soon as we were able.
Thanks, that's helpful. And maybe just kind of, I think to that point, I guess that it seems like the trickiest situation is doors and windows are closed. and kids need to eat inside, because then you have unmasked kids, and obviously there's lots of cases of transmission in that kind of environment. I guess what is the school policy on, I guess, what's the threshold for kids eating inside? And then are there policies that you guys are working on to mitigate that, having kids like eating in pods or rotate them outside to eat, because, you know, in groups, or I don't know, how have you thought about that? That seems one of the what trickier cases.
So on that scale, over 200, I believe, is the point that we start having students eat inside. And when we do that, we would have them eat inside in larger spaces. So it wouldn't necessarily be contained to just their classroom. We would move them to MPRs, gymnasiums, libraries where they could sit further apart again. We would mitigate that as much as possible so that they had more distance. It's also possible, depending upon how much we're talking about, how many days, that we start sending meals home with them to eat, so that they're not necessarily, if we don't have enough spaces to spread them out, that they would bring the food home with them to eat.
And how is that decision made? Is that the school level or the
We
district level?
follow the guidelines set forth by the county, and then we follow it for the whole district. So they have, so if you got my communication, I think it was the week before last, it linked to the county's, I think it's called the AQQMD, the Air Quality
Right,
Management
70-page behemoth.
Yeah, and so it gives a color coding, and it gives a link to the monitor, which for us is in Redwood City, and it actually says very specifically what we're supposed to do depending upon the color of the air quality monitor.
Yeah, but I guess I was thinking about the sending kids home versus spreading them out. Is that something is that a sort of a school by school basis, depending on?
So we send them home above 300.
Okay, and then for lunch, you said that you'd send them home under some circumstances.
No, I said we would send them home with the food at the end of school. So in other words, we might not eat lunch in school if it gets that bad.
Okay, all right, thanks.
Thank you, Mike. Next up will be Amanda Lichtenstein. Go ahead, Amanda.
Hi, everybody. Thanks so much for taking the questions. I had a couple protocol questions rather than Binax questions. I hope that's okay. My first one was if you could talk for a moment about the quarantine protocol for siblings of a positive case. I read today that the siblings could be kept home for up to 24 days if they remain asymptomatic and testing negative through their siblings isolation. The 10 days of isolation and then 14 days of quarantine from the last day of isolation. And that surprised me and sounded long. I wondered if it might surprise other people and thought it might be worth talking about. And then I also wondered whether or not there's any San Mateo guidance that you know of that differentiates between a vaccinated close contact and a vaccinated member of the household, because to me it feels a little, or my gut tells me that there's something different between, you know, within 6 feet for more than 15 minutes and living all the time under the same roof. So but I couldn't find any difference in the guidelines. So I just wondered if you guys have thoughts about those things.
Hi there, Amanda.
Maybe I could take
do you want to start on that one, and then I can add?
Sure. Let me take a stab at the first question. That is such a good question, and you're raising a bunch of different things all in that one question, which are all really good points. It's a difficult situation when there's one case of COVID in a household, because it tends to create overlapping blocks of time that, as you said, can start to add up and get kind of long. The specific situation you just raised was, I think, one child, let's say, who's positive for COVID. So assuming that the other family members, the goal would be to try to achieve as much isolation as you can. I know it's extremely hard. I mean, a child, we have to be with our children, take care of them. So it is difficult. If there was a way to have the other sibling isolate away, they could be considered in quarantine starting from that same day that the first child got diagnosed. So it wouldn't be 10 plus 14, it would be the 10 days of, so isolation is for the COVID positive person, that would be 10 days of that. And that would also be the first 10 days of the siblings' 14-day quarantine. So there'd be another 4 days beyond that, and then they'd be done with their quarantine. Did I get that scenario right? I just want to make sure I was hearing the question right.
That's my understanding as well. Yeah.
That's interesting. I did reach out today to the San Mateo public health officer and heard a different story. So that is interesting. In that, if that sibling were to test positive on the first day of their sibling's isolation, that scenario that you described would be true, is my understanding. And yet, if not, and they remain asymptomatic and testing negative through the last day of their sibling's isolation, day 10, their quarantine would then start on the following day, so plus 14, getting to 24. So I just think it's
so that could be true if there was absolutely no form of separation between the siblings. So let's say, and that is definitely possible in lots of households, so that the sibling with COVID, if we were not able to have any separation between that sibling and the sibling who has tested negative, then you're right. You're absolutely right that the COVID positive sibling could create exposure to the COVID negative sibling all the way up to the 10th day of their COVID positivity. So, and you would time the quarantine from the last exposure. So in that case, you're right. So it really just depends, Amanda, on the ability to have the COVID negative child effectively separated from COVID positive child, which is going to be, doable in some situations, and I totally agree with you, not doable in some other situations, difficult situations.
Thanks.
And the second question, could we loop back to that? I lost the trace on it. I'm sorry.
Yeah, no problem. You can see my curiosity got the better of me when I was deep in protocols today. But around members of the household who are vaccinated, as compared to vaccinated close contact. From what I can tell from reading guidance, those are the same thing. To me, not a practitioner, my gut tells me that those are different. Again, I guess it depends on the amount of isolation you can do at home, but just being within and exposed within 6 feet and for more than 15 minutes feels a little different than living in the same house with a positive case. And yet, if vaccinated, it seems the guidance is that you don't need to quarantine. And I just wondered, if we have any thoughts on that within the district.
So that it's a couple of layers inside. That's a very complicated question. A couple of layers inside of that. I wanted to first make sure I was understanding, like, a contact to a contact is not really a thing and not a source of worry. So I just want to clarify in your scenario that you were laying out, there is a COVID positive child. Is that what you were asking? Or is the child in your scenario a contact to someone who's a case in their classroom? I didn't quite get that.
Yeah, sure. Sorry, I feel like I'm not communicating so clearly, but I was trying to follow and trace the protocols for a vaccinated member of the household with a positive case. And the closest protocol that I could find that was relevant is a vaccinated close contact. But to me, those feel like different things.
So they are, for school districts, they are, Amanda, because if it's a vaccinated close contact in the context of school, the assumption is that they're masked, right? Versus you would not be masked at home. Now, the other thing that we've dealt with, and this is why public health gets involved, if there's let's say there's a vaccinated parent that calls us and says, I'm positive, I got the positive test and I'm isolating in my bedroom, my spouse is taking care of the children, then typically they will work through the type of isolation that they're able to do or quarantining in the home with public health. And public health actually tells us the number of days of isolation and quarantine needed depending upon the household situation. But you're absolutely correct that it is different when you're cohabitating because there is no longer an assumption of masking going on. And
yes, that makes sense. And I'm glad to know that the guidance comes from the public health department.
Yeah, that's who our nurses coordinate with to determine every situation's quarantine and isolation requirements.
Thanks so much. That's helpful.
Sure. Anything else to add to that, Vivek?
No, I think that's right. It's just the, you're absolutely right. It's because we don't mask indoors in our own homes. So that is a fundamentally different form of contact for sure. Yeah.
Any
Thank
other
you.
questions, Mr. Diktakis?
Yes, Bonnie Murphy will be up next. Bonnie, go ahead.
Thank you. Can you hear me?
We can.
Okay, great. So I was just wondering what percentage of students in the district signed up for Binax?
Oh, goodness. I think people are still signing up, Bonnie. So I don't know. I haven't looked at percentages of how many have signed up. So the parent usually gives us permission in the event of a break. I'm sorry, a positive case in a classroom. We've only had one situation where we've had to do testing. So far this year, with all of our different testings, we've only had one positive case in a classroom. And we initially did not have the whole classroom signed up, but the parents were notified. And because it's fairly easy to do, and because the parents wanted their children to be able to stay in school, they all signed up to get the testing so that we could do it the very next day. And all of that first round of testing in that 10-day period has already occurred.
Okay, so your comment actually dovetailed to my second question, and that is if there is a positive case in a classroom with the close contacts, if they are not signed up, then do they have to quarantine, or what happens? What do they have to do?
Oh, that's a great question. So the protocol from the county is interesting because, again, we are masking as long as they're asymptomatic and wearing a mask at the time of presumed contact, then we can let them stay in school as long as they are getting the testing and they're staying asymptomatic. So those are currently the criteria. Any more details than that, either Vivek or Shreya?
Yeah, so exactly. And therefore, Bonnie, you could wonder sort of like, what's the point of the Binax? Because if we didn't have this augmentation to our program, we would just have the kids on the modified quarantine and staying in school. So really the benefit then is just that we're able to get information for kids in the classroom and their families and not miss cases of COVID that could be asymptomatic and silent, which can happen. 40 to 50% of all COVID cases have no symptoms. So it's a great question you're asking, and the other part of your question is also really great, is that the usefulness of it increases with the more folks that participate. Of course, it's totally voluntary, the program, and if anybody doesn't want to participate, it's no problem. It is completely voluntary, but the readout of the information and being able to give families information is helpful, even if it wouldn't have been required by the county.
Okay, so I guess what I'm understanding then is the net effect is the same. If a child has an exposure in the classroom, what the close contacts are supposed to do remains the same, whether they're enrolled in Binax or not. They just mask and monitor for symptoms. Is that true?
If a vaccinated child in the class is enrolled, they can get a Binax test and have an opportunity to get some information, and we could catch situations and help give that information to families. If they're not enrolled, we're sort of, which is fine. If it's fine to not enroll, then we just don't have the opportunity for that test. And if the child is unvaccinated, which would be, all the elementary school kids at this point, and there was a unmasking, if there was a situation where there was an unmasking, then you can't do the modified quarantine option. But if you were masked, and we really, all situations should be fully masked if we have good compliance, then you can do the modified quarantine. And then the benefit is that the Binax is it's a super easy way to do your twice a week testing, rather than a school district that doesn't have a program like this. They can also do the modified quarantine, but people have to go and be responsible for their own tests. You got to go out, find a testing center, do it on your own. It's PCR. You might take a day or two for the result. And that work of doing that will be individually placed upon every family. So, which is in order to capture the option of the modified quarantine. So in those two different ways, it really streamlines and makes it easier for kids to take advantage of the stay in school option.
Okay, so then the modified quarantining is being tested twice a week by some means, whether it's Binax or PCR. Is
correct, Bonnie. So the difference is that the Binax we can do at school, and then the school teacher as well as the school can have the result right away along with the parent, versus saying to the parent, hey, you have to do testing twice a week for the next 10 days. Go find it in the community and get it back in enough time so that you have the positive or negative result to report to us. And it has to be every 3 days within a 10-day period, essentially.
Yeah, got it.
Okay. Sorry if that got a little confusing.
No, you answered all my questions.
Great.
Thank you, Bonnie.
Thank you.
Okay, Superintendent Mt Bonitas, that was our last question so far. In case there are new attendees, just to remind you, if you have a question, please raise your hand.
Great. And while we're waiting to see if there's any final questions, any final thoughts on hearing the conversation from the panelists this evening? Anything else to add that came to mind?
I just want to echo something that Joelle had hit upon early, which is just the gratitude to everyone at the individual school sites for their support of this, and just, you know, all the everything that the journey will go on this whole year, you know, to have a good school year. And you know, I'm a doctor, but mainly a parent, you know, in the district, and grateful to have the support of the district and all the teachers and staff, and all of the parents, you know, for all of us to kind of go through this fall and winter together, and you know, have as good of a year as we can. So thanks to everybody.
Great. Any further questions, Mrs. Tiktakas?
We appear to have one more. So Angelique, I'm going to go ahead and unmute you.
Hi, good evening, everyone. So I have a question regarding logistics and privacy. So let's say one of my daughter is a close contact of a positive student. She would now have to get tested twice a week through Binax. What are the procedures when it comes to this Binax testing? Do we do it right before they enter the school? And let's say she turns out to be positive, I would imagine that it would be pretty obvious that she would be sent back home. I just kind of wanted to understand how that would work.
So I will just a couple of thoughts, and then I'll let other folks that have done it. So I've actually participated in the testing so far of kids. I got trained and have been supporting that. And so there's a couple of things there, Angelique. So first of all, as Vivek stated a little while ago, it is not required that you sign your child up for the Binax. So it is not a requirement. So they don't have to test, but we see it as an easier way than taking kids in and out of school and then having the parents get tested and then give us the results. So it's a way that you can quickly and easily do it at school. I will say also that the test is rapid, it is accurate, and the students all spread out and do their test. So they don't stand there and share results. None of that happens. It's done sort of in a group. And then there's a time that we have to wait to be able to read the test. It's 15 minutes. So the students are all going about their business, they're masked, and then we notify the parents. And so it's done in a thoughtful way. It's not like we're calling kids out and saying, so-and-so tested positive today. So everybody that's a close contact would be potentially testing, and it's done in an environment that it's not clear to the students what the results are. That's why there's an adult tester doing it. So we don't share that information. And it is optional, like we said, it is more of a convenience for the parents rather than a requirement. However, to do the modified quarantine, if you don't do the Binax, then you just have to pursue testing on your own in the community. Any other thoughts about that? Some of you have done the testing with me already, or in addition to me. Any other thoughts on privacy? Go ahead, Mrs. Tiktakis.
I was just going to say that we conducted one this week, and we are very discreet about it. We do it in a discreet location. And you mentioned, do we do it before school? Yes, we did.
Well, so that's a great point. We did do it before school, but the requirement is not that it happens before school. Right. It is that we do it twice every week or every 3 days. And so it depends upon the availability of the folks that are qualified to give the test. So we did do it this week, and we were able to do it at 7:45 a.m., which was before school started. But there will be times, I actually did it during the school day because we were initially notified during the day. So the Binax test can be done anytime. It's whether it really depends on the availability of those trained to do the testing. Just to clarify for folks, it doesn't have to be before or after school. We have been doing it also during the school day. Does that answer your questions, Angelique, or did you have other questions?
No, that's good. Thank you.
Great, thank you.
Thank you, Angelique. We have one more question. Lynn, I'm going to unmute you.
Hi, quick question. So in that scenario where a student doesn't feel well in the middle of the day, goes to the office, and then may get a Binax test on the spot, if it is negative, are they still sent home, or would they be allowed to go back to class?
So maybe I could say a quick word on that. We are trying to get clarity on one aspect of that really good question. Right now, we're envisioning the possibility that we would do the Binax, but also send off a regular PCR test. And then when the PCR test comes back negative, which might take a day, that would be one criteria to come back. But also, since they were symptomatic, the symptoms have to get better, and they have to finish the isolation for whatever was going on with that symptom, the thing that was not COVID. So once all that is sorted out, the kid could come back. We are trying to get clarification that maybe that the parallel PCR test might not even be necessary, and we could just do the Binax test, and it's negative. Great news, they don't have COVID, but they would have to, just like normal stay at home until the symptomology and that little syndrome that was happening is all better.
Okay, thanks.
Thank you, Lynn. We have one more, actually two more. Bonnie Murphy will be up next, and then Gina Fleming.
Hi, thanks for taking my question again. So I was wondering how important the Ambry testing is to the school system, because getting samples of the kids in the morning before they've had a bite to eat is difficult. And I was able to find, a bunch of the Binax tests for sale at Walgreens, and it's comfortable and it's easy. So if, as a household, if you want to just test your kids and have that information for peace of mind, is it important for the school to have families participate in the Ambry, or taking it upon themselves to do it at home? Is that,
It's only important, Bonnie. It's not a requirement. It's been more for access for our community so that every family can get free PCR testing that's sort of convenient. You know, you can pick it up at your local school site. You're right that as this has evolved, testing has become more and more available. So yes, the Binax, if folks are interested in what it looks like or even how to do it, you can buy it at Walgreens, CVS, your local pharmacy. I think it's 2 of them for, I don't know, $23 or $28, depending upon where you go. So you can see the type of testing that we're doing and why it can be done in school. It's really not, other than the training, which is basically, you know, having folks watch us do it correctly a few times. It's not a complicated test to run. So you're correct, parents can. And so the different options we have for parents to get access to testing right now are their own healthcare providers, the Binax that we're providing, the Ambry that is being provided in a volunteer fashion through our PTAs, as well as the curative van is still at the BIS parking lot on Mondays for our community testing site that we set up with them last year. So those things are all still available. The importance of testing that we're trying to encourage, and maybe the doctors have thoughts about this, is just so that we have an idea, sort of both on the surveillance level as well as the I guess I would call it the psychic comfort level of information being available to parents and to the community, that we are being vigilant, that we are testing, that we are being aware and making sure that the information is available to our parents and that they have options, so that we aren't putting barriers in the way of you accessing and continuing to operate a successful school year, which is always my concern for our kids. So none of it is mandatory. It's just multiple ways for us to make sure that the community has information that they might want.
Right.
I would just add the cost of $12 a test is, you know, a barrier for some, and sometimes I've been at CVS and they have them, other times they've stocked out. And then it's great. Any form of testing is great. More testing is better. If families do their own testing, like Chris said, we wouldn't be able to know the results or count them in, you know, town-wide data that we could put out there. Whereas the Ambry, we can just post up all the numbers. Like this first round of Ambry, to me, just so encouraging to see that the number of positive tests infinitesimally small, you know, across a pretty large sample of the students in the school district. And for that to happen in round 1, when everybody's been, you know, lots of places over the summer and doing different activities and camps and stuff, just to me, incredibly encouraging, reassuring data to start the year with such a low COVID situation in the district. So, and that data just carries more, you know, just more compelling the more people have the sample in the Ambry, but totally voluntary. And just, you know, there's some weeks where just, you know, the schedule doesn't work out to do it, and other weeks where it'll be convenient and easy and it's no problem. I think it's more of like an aggregate thing. So the more participation, the better. I hope that makes sense.
Yes, it does. And then what about if you pick up a test and your kid eats a bite of food? Can you keep it for 2 weeks later and use it at that point, or is that test wasted?
So Bonnie, I can answer that. So the test, they're fine. You can keep it. They're actually good for 1 full year. So you can keep it. And the second thing I want to mention is you can actually have your kids provide that sample the night before.
Oh, okay.
That's also fine. Yeah. Morning of or night before is fine. So again, we just don't want them brushing their teeth, eating, chewing gum, anything of that sort. But you can do it the night before.
Okay, I thought it expired. I thought you had to do it and then you had to get it there within a certain number of hours.
No, actually, by the time you put the saliva in and that reagent that's in the top part of the test, when you release it, that actual samples, it's actually technically good for 7 days. So it has a pretty long shelf life. But obviously the testing that we do, you guys drop off on a Tuesday. And if actually the barcode on the tube is put into the portal, they're very quick. Results will come out by Wednesday. Some of the delays we had this first time around actually had to do with a lot of new users into the portal and not registering the actual barcode of the tube. And hence we had some delays in reporting. They came out by Friday this week. Typically though, we should have most of our results in by Wednesday because they'll receive them Tuesday night or Wednesday morning.
We actually, to sort of piggyback on that, we heard previously, so Dr. Shaw already checked out that we could do the night before because it was more convenient also for parents to get their kids to remember the night before. So it was sitting on the counter. So you can just grab it in the morning and not worry about spitting in the morning. It's already filled with spit and you can just drop it off. So that was sort of a gross statement to make, but there you go. So spit the night before and have it all prepared for the morning. It's more convenient.
Yeah, thank you so much. That's so helpful. This mornings can be pretty hectic and yeah, appreciate it.
Great.
Thank you, Bonnie. Okay, we have one more question. Gina Fleming is going to be up next, and it appears that we don't have any more questions. And to be respectful of everyone's time this evening and our doctors, we're going to make this our last question.
Great, thank you.
Gina, go ahead.
Hi, thanks for taking my question again. Thanks for, I can tell you guys have put a lot of thought into these protocols, so I really appreciate it. So my question actually just came to mind is, is there any threshold for closing a class? I know that the goal is to keep kids in class, and that's why we have the rapid testing and the modified quarantine. But should we get, and hopefully this won't happen, but should we get to a point where, we're seeing, 3-4 positive cases in a class? Like I know that Foster City Elementary School, I think they closed a class or 2 classes because this happened. I'm just curious, is there any protocol for okay, when a certain class has X amount of cases, we just kind of chill for 2 weeks or something like that? Or likewise, if parents don't feel comfortable sending their kid, let's say there's 3 cases in class, and I understand that the class won't close, but if I don't personally feel comfortable sending my child to class for a week or 2 while those kind of die out, is that an option? So those 2 questions.
So I'll let the second part, I'll let Assistant Superintendent, she's over there smiling already. She knows I'm going to send it her way because it's Ed Services side. So she'll give you your options on if you don't want to send your child for a week or 2. On the first part, there is no longer. So the old protocol, when we had less information last year, was that when a classroom or a school site reached an outbreak level of over 5%. This year, that is not the case. It's just every situation we are supposed to deal with separately. And so there is no longer a certain level of transmission within a classroom or a school site that triggers a closure. However, if you are not comfortable because you're told that there have been multiple exposures in the classroom, then Assistant Superintendent Silversmith, what are the options for parents?
Thank you, Gina. If you're uncomfortable with your student attending for any reason, we definitely want you to reach out to your principal first. There are options. There is short-term independent study, which can help support a student for under 15 days if they're missing school for under 15 days, which can also be a quarantine if they're needing to quarantine. And they would be supported with independent study work from their general ed teacher, and it would be packets and information that they're learning within class, and that would be completed independently and then turned in. The good news is that also counts for your students' attendance, so they're not considered unexcused or absent. They're still continuing to learn during that time. So again, if you find yourself in that position, please reach out to your teacher and your principal, and we would be able to support you.
Thanks very much.
Great. So I just want to end by letting you all know that we appreciate you requesting and attending this evening. I see that we had a little over 60 participants at our height. So we're glad for the interest and glad to provide the information. And thank you all. Vivek, Shreya, always volunteering, district office staff, another night that I'm sure you appreciate. Add it to my tab. And stop laughing. And community members, if you have folks that are interested and weren't able to make it, we recorded this evening's session. We will be adding it to our Red Mask COVID tab on the website, the link, so that folks can go back and listen to the information on their own. And please encourage them to do so if you think that there's some interest. So with that, I will say good night to all. Thank you so much for your time. I appreciate it. And everybody have a good evening and stay safe.